Good morning or good afternoon, everybody, depending on your location, and welcome to APEA's Town Hall meeting for NP students. My name is Dr. Amelie Ollier, and I'm President and CEO of Advanced Practice Education Associates. You know, for the last 23 years, APEA has helped NP students achieve their goal of NP certification, and that's why we're here today. It's because your challenge is a little bit greater and we want to help. I'm going to share my screen here and show you the slides that we'll be using today. And here's our first one. I want to introduce you to our team. And here they are. This is our support team. This is really the team behind the scenes. I want to introduce you to Maureen Garcia and Sarah Reed, and also Jeannie Doucette, who is my business partner, and Nina Gosson. The moderator for today's town hall meeting is Michelle Perron. And Michelle acts as APEA's Director of Marketing and Communications. And since 1993, just to let you know that Michelle is not new to the NP world, since 1993, Michelle has worked and interacted with NPs. And she was the editor of a national nurse practitioner publication. And when I asked her this morning how long she had worked with NPs and people in our profession, she said, Amelie, 27 years of respect and love for the profession. So, Michelle, we're very, very happy to have you as our moderator. I want to get this out right away so that if you need any help during the webinar, you know exactly how to get us. Please use the chat feature in Zoom. That's the quickest way to get help right away. But you can also call our 800 number, and you can always email us. We have people, and you just met them, who are waiting to help answer your questions. And so today's panelists are right here, and I want to introduce you to them. The first person I want to introduce you to is Dr. Kathy Baldridge. And Dr. Kathy is a family nurse practitioner who's in clinical practice in central Louisiana. She works for APEA as our Director of Psychometric Analysis, which means she knows all about testing and scores and question reliability and validity and predictability. So she's got good information for you today on the testing process. The next person I want to introduce you to is Betty Vicknayer. Betty is a pediatric nurse practitioner who lives in New Orleans, Louisiana. She worked in a very, very busy pediatric practice until Hurricane Katrina came. She's no stranger to dealing with adversity and working through challenging situations that happen to change your plan. She's got some great words of encouragement and a lot of good information for you. Right now for APEA, she works as our faculty liaison. She works with the universities and the faculty in the universities to help with curriculum development and just overall help with faculty. And the last panelist that I want to introduce you to is Jennifer Oakley. Jennifer is a family nurse practitioner who works with APEA on special projects. And basically anything we ask Jennifer to do, she can do. She's also our Director of Continuing Education, but there's something special about Jennifer that you need to know. She works on the front line. She works in a very, very busy Philadelphia PA ER, and she's, involved with COVID fight every single day. So Jennifer, from all of your friends at APEA, thanks for all you do. We really mean it. Jennifer is going to be answering questions as our nurse practitioner online. So she'll be involved with some of the chat questions and also the Q&A. So there we are. And if you have questions during the webinar, we want to make sure that you ask them to us. Our moderator is going to toss them out to the NPs, but we'll also be answering them online because there are several hundred NPs on this webinar. So we're really excited about the turnout. If you're not able to get this webinar, it's going to be recorded and placed on YouTube probably later today or maybe tomorrow. So that is there to help you. This is where we're headed in our town hall. These are the 3 big areas that we want to attack for you. We're going to talk about how to create a detailed study plan, and Dr. Kathy Ballridge is going to do that. Then I am going to talk about using rationales to help you develop critical thinking skills. And then the last section is going to will be Betty Vicknair, and she's going to talk about how to stay focused and how to stay motivated during this very challenging time. And then we'll have lots of time left over for your questions and answers with the NPs. So as we get going, we want to find out a little bit more about you. And so to do that, we have a poll for you. And I am going to share the poll right now. And this is going to help us kind of tailor our discussion today. So here's the first question I'd like for you to answer. And it is, I have graduated and I am waiting to test. So I'll give you about 20 seconds or so just to kind of answer that. I've graduated and I am waiting to test. And Kathy, it looks like we have a lot of people in that direction.
I'm not able to see the results.
Okay, I can see it and I'll tell you.
Okay, good. Thank you. Thank you.
I have graduated and I'm waiting to test. Okay, I'm going to stop this one and I'm going to get to the second question. And it is, my graduation was delayed because I haven't completed all of my clinical hours yet. And I'll give you just another 10 seconds or so. I wish the questions on the exam were this easy.
Okay,
I'm going to end this poll right now. And here is the third and last ones that we want to ask you about. We want to know what resources you have so that we are able to guide you in a good direction as you study. So we want to know if you've taken a predictor exam or something that lets you know where your weak areas are and where your strong areas are. We want to know if you have access to any kind of practice questions, because I'm going to be talking about that and want to make sure that and it looks like, yeah, we have an overwhelming number of people who have practice questions. And the third part is, do you have some kind of clinical guidelines book that will help you in the preparation? And very good. I'm going to end this poll right now. So Kathy, it looks like we have a lot of people who have graduated and are waiting to test. And we also have, in about a 2-to-1 ratio, we have a load of people who haven't graduated yet, but who are very, very close.
Okay.
So that'll help you.
It will.
All right. So I'm going to close this and I am going to share the screen again. And if you give me just a minute, I'll get there.
Absolutely.
All righty.
This has been a new world, learning technology, doing things a little different way.
Yeah, you're right. Let's see. And I seem to have lost here we are. There we go. We're sharing again. All right, Kathy. So we talked about this being the order, but I'm going to let you go ahead and get started. And you let me know when you want me to change the slides for you.
Okay, so we're going to help you learn how to create a detailed study plan. And you can go ahead and go to the next slide, Dr. Amelie. We asked you those questions because we wanted to know exactly who we were talking to. And we thought we might be talking to 2 different sets of people. One, you were supposed to graduate, but you were delayed because you aren't able to finish your clinical hours. But there are some things that you can still be doing in the process. And next slide. The second group of people was, I graduated and I can't take my test. And I've heard from a lot of you, we've gotten a lot of emails, your tests were scheduled, man, you were poised and ready to go take that exam. And then you get notified that the testing center is closed. And so you're not going to be able to test. And some people have rescheduled for mid-April. And it's probably not going to happen in mid-April either. But we don't want you to lose the momentum that you have and being ready to test and being confident in the knowledge that we know that you have. So next slide. So we're going to tell you the best method for creating a detailed study plan so that you can continue with that momentum, continue to focus on the areas that you need to remediate. So when those testing centers open back up, you're going to be poised and ready to go, and we know that you're going to be successful. Next slide. So Dr. Amelie, one of the questions that we asked them was, had you taken a predictor exam? Now, APEA has predictor exams. There's other things on the market like readiness exams. As long as you have taken some kind of exam to kind of let you know what areas you're weakest in, that's great, and that's what's going to help us to build our plan. This is a picture of what our predictor results look like. We tell you the total time that it took you to take the exam, how many questions you answered, what your overall score was. Our predictability is 70%. So if you score 70% or higher overall, then statistics tell us that you are highly likely to pass that certification exam on the first attempt. So next slide. So how do you build your plan? Further in the results of the predictor exam, it's going to break it out into knowledge areas. So you can see there they have a score in cardiovascular, they have a score in dermatology. It goes all the way through all the knowledge areas. Any area, even if you score better than 70% overall on your exam, I want you to look at this, because any area where you scored less than 70% is an area that you need to go in and you need to beef your knowledge up on. Okay, so that's where your study plan is going to come from. Start with the area that you scored the lowest and then work your way up, because you want to spend the most time on the area where you scored the lowest. Get yourself a calendar, a day planner, something, and I want you to actually schedule your time. We have busy lives. There's lots of things going on. A lot of you are still working on the front lines. And so you see 7 a.m. on Monday, work at the hospital, working a 12-hour shift. So you take the days that you're working, you plot those in, but then the days that you're not and the downtime that you have, I want you to schedule yourself. Tuesday, I'm working on dermatology, and I want to work on dermatology for 8 hours. Wednesday, I'm working on cardiovascular. Stick to your plan as best you can. That's going to help you stay focused on the areas that you need to remediate in. Now, one of my favorite sayings is, when you're busy doing life, guess what happens? Life happens. So sometimes there's going to be events that come up and you can't do cardiovascular on the day you have it scheduled. The very first thing you do is you go ahead and reschedule cardiovascular, just like you would reschedule any other appointment, because that's going to help you the best to stay focused on what you need to stay focused on. Next slide, Dr. Amelie. So when you're, back one, there you go. When you are looking at your test results, another thing that you can do on the day that you have cardiovascular scheduled, you go to your exam results, you click on the plus sign beside cardiovascular. It's going to show you the diagnosis of the questions that you had on your predictor exam. It's also going to show you which ones you missed. So if you missed one on lipid disorders and pharmacology and you're studying cardiovascular today, that's one of the things that you need to have on your plan for that day, is to review the pharmacology for the management of hyperlipidemia. So that helps you just dig down a little bit deeper on those days that you have the knowledge areas scheduled, like cardiovascular. Next slide. So when you're on that day, this one's respiratory. So you're looking at respiratory for this day. This is how your thought process needs to go. I have acute bronchitis I need to review. I have pertussis, TB, pneumonia, COPD, asthma, and lung cancer. Those are on my diagnosis list for today. And when you're reviewing those, then you're going to go through, what's the clinical presentation for acute bronchitis? How do I know how to diagnose acute bronchitis? What's going to be in the differential diagnosis for that? What is my pharmacological management and my non-pharmacological management? What follow-up care do I need to do for those patients? Recognize the normal course of that disease process versus complications that you may see. That's going to help you really seek that knowledge for you. It's going to help focus your study. And those are the areas that you need to review. The Clinical Practice Guideline book is a great way to do that because it has every single one of those areas highlighted for you and bullet pointed in a simple way that you can be able to retain that information as you go through it. Next one. All right.
So I think we're ready to attack the second one. Kathy, thank you very much. That'll give them an overview. Let's talk about how to approach those multiple choice questions. And I kind of entitled this section, Using Rationales to Help You Think Critically. And kind of the subtitle is, so that you can nail those multiple choice questions. Well, you know, I'll bet you that the most common question in my email box is this one. It says, how do I pass the NP exam? And my answer is always the same. You have to be able to critically think. And so what is that? Well, I'll tell you what it's not. It's not memorization of facts, and it's certainly not memorizing the answer to a multiple choice question. Critical thinking is the ability to answer a question and the ability to question an answer. In other words, you always have to ask why, because why the answer is correct is what's going to deepen your understanding, deepen and broaden your knowledge base with regard to that topic. So you have to be able to critically think. Now, how do you develop those critical thinking skills? Those are things that I hope you've been able to develop as you go into your clinical practice, and also, as you've taken questions and you've answered multiple choice questions. But here's what you have to be able to do to develop critical thinking skills, and I'm going to practice a couple with you. The first thing you have to be able to do is look at the stem of a question and pick out the relevant facts. And you need to toss out the irrelevant facts. That's exactly what you're going to do in an exam room with a patient. Now that you have a good set of facts, you're going to look at those and develop the most likely conclusion. And to be honest, it takes a lot of practice. So let's go through one. Here's the first question I'm going to go through with you. It's a 34-year-old male who has pneumonia. He's a non-smoker and he's otherwise healthy. The question asks, how should he be managed? So the first thing I want to ask you to help me pick out are the relevant terms. Well, obviously, his age is very relevant. The second thing that's critical to your answering the question is his diagnosis. They've told you that he has pneumonia. He's a non-smoker. You know why that's relevant? It's relevant because it lets you know that although he's got an infection in the lungs, he's probably got a healthy set of them. So he ought to get better as expected. And then finally, the other relevant piece of information is that he is otherwise healthy. You know what that means? He's not immunocompromised. There's nothing else to suggest that something is going to delay his getting better with pneumonia. So those are your relevant key terms. Now, how do you answer the question? Let's look at number one. Number one says, treat his symptoms only. Well, no. All of the guidelines for treatment of pneumonia in outpatients or community-acquired pneumonia or hospital-based pneumonia, nosocomial pneumonia, says you got to give an antibiotic. So number one is certainly not the answer based on the knowledge base that you should have. Look at number two. Number two says prescribe a macrolide antibiotic. Well, that's a good choice, but there's something I want to make sure you remember. Always, always, before you select an answer, make sure that you look at all of the choices. So we have to look at the other two choices before we settle on that one as the best answer. Look at number three. Number three says prescribe a respiratory quinolone. You might have seen that done in your clinical practice, but this is a good reminder that when you answer questions on your exam, you must answer them based on either a standard of care, a national guideline, or a big old body of evidence. Prescribing a respiratory quinolone may be what you saw done in clinical practice, but the evidence-based guidelines don't recommend that. Consequently, number three is not a good answer. Look at number four. Number four says prescribe high-dose amoxicillin. It's not the correct answer on your exam, and let me tell you why. Prescribing high-dose amoxicillin is a brand new treatment methodology to treat pneumonia. It came out in December of 2019 with the brand new pneumonia guidelines. So when you answer the questions on your exam, I want you to make sure that you remember that your exam is going to be about a year and a half or 2 years old when you get to it. So knowing the latest, greatest information is probably not going to help you as you answer those questions. So when I just look at this question, I think your best answer is number 2. Now let me show you what else you can do with these questions, because for everybody, money is short right now. As you study, what I want you to do is take the multiple choice questions that you have access to, and I want you to change 1 or 2 facts in the stem of the question. And then I want you to re-answer it. Because if you can do that, what you are telling me is that you can critically think. It gives you good practice at critically thinking. So let me give you some examples of what I'm talking about. Suppose that this man was allergic to your first choice, which was a macrolide antibiotic. What would you give him? Well, how about doxycycline? That means that you have to know those guidelines very well. Suppose that instead of a 34-year-old, this man was 84 years old. How does that change the way you answer this question? Well, it changes a lot, because the evidence-based guidelines say for an 84-year-old, we want to give him a respiratory quinolone. And then finally, add a different fact. Suppose this patient was pregnant. Well, you certainly are not going to give her a quinolone. We're not going to give her doxycycline because she's pregnant. A macrolide I would really shy away from, but if she was pregnant, my first choice would be amoxicillin. So I want you to take the questions that you have, and I want you to re-answer them after you change 1 or 2 facts in the stem of the question. It's going to give you great practice at critically thinking, and it's going to help you get some more mileage out of the questions that you have. Let's look at another question. Here's your patient. He's Mr. Smith. He's a 56-year-old who's newly diagnosed with diabetes and obesity. What medication is most important to prescribe for primary prevention in him? And I'll tell you right now that he takes no medications. Well, let's look at another strategy with questions. I want you to pay attention to the stem of the question, but then I want you to go and look at the additional information they give you. So let's take a look at it now. His blood pressure looks pretty darn good. I'm looking at his lipids, 210, 130 LDL, HDL is 28, triglycerides are 323. I'd really rather him be better. I'm looking at a fasting glucose of 165, and I've got an A1C that says 8.4%. So right now, I know this patient has diabetes. I also, after you go through your information, what I want you to do is go back and quickly reread the stem of the question and reread the question. So this is a man with diabetes and obesity, and the question reads again, what would be most important for primary prevention? So listen, you may want to say, Amelie, let's give him a fenofibrate to treat his triglycerides. Well, you probably know, or hope you know, that we never give a fibrate to a patient unless the triglycerides are at least 500. So number 1 is not the correct answer. Number 2 says lisinopril, his blood pressure is fine. Sometimes in clinical practice, you've observed clinicians giving an ACE or an ARB to a diabetic for renal protection. There's no guideline that says to do that, including the ones from the American Diabetes Association, which is what you should be relying on when you answer questions on this exam. So I'm not going to pick number 2. Number 3 says give him metformin. That's a great answer, but it doesn't answer the question. The question says primary prevention, and there's only one drug up here that does that, and it is pravastatin. And how do we know that? Because you're familiar with the hyperlipidemia guidelines by the American College of Cardiology and the American Heart Association. So for primary prevention, the best answer is number 4, pravastatin. All right. So hopefully those kind of warmed you up for the way you ought to be thinking about some of those multiple choice questions. Just one or two more things before we move on. And here's the first one. When you answer a multiple choice question with whichever ones you have, I want you to focus on the rationales. I usually tell the students I teach in person, I want you to inhale the rationales because those are going to grow and they're going to stretch your knowledge base. And that's what you need to be focused on right now. And then finally, here's my last clue for you. As you prepare for your certification exam, I want you to make sure that the practice questions you are using are not just knowledge level questions. In other words, they're not questions that ask you, what's the best test to diagnose mononucleosis? Oh, a monospot. Your questions on your certification exam are going to not be at the knowledge level. They're going to be at the synthesis and comprehension and analysis level, which means you have to be able to critically think in order to be able to answer them. So make sure that you use those practice questions that are a higher level and focus on the rationales. Kathy and I will be waiting for your questions, but I'm ready to talk to Betty Vicknair on staying focused and motivated. Betty, are you ready?
I'm ready. Thanks, Dr.
Right, Betty.
Thanks, Kathy. Staying focused and motivated. Wow, that's much easier said than done, right? We hear you. You probably worked a few 12-hour shifts. You're experienced more than you'd like to discuss. Maybe you're coming home to a spouse that's unemployed, children that need your attention, aging parents you're concerned about. Maybe you've had to cancel or postpone your wedding plans, but all you really want to do is just collapse. We get it. But you have to stay focused and stay strong. How do you manage that? No matter how you feel, you've got to get up, dress up, show up, and most of all, never give up. So let's try to focus on 3 things that might help you accomplish this. One is communication. The other one is time management, and the third is stress reduction. So communication. Let's keep those lines of communication open with your families, your friends, your classmates. Keep things in perspective. Communication is going to help you relieve that stress and tension because sometimes just venting helps you keep these things off your chest and relieve some of that stress. But you've got to keep those lines of communication open, and you've got to listen to your family members too because they're all struggling right now. The other thing that you're probably worried about is your job. You know, you were supposed to take your graduation ceremony, you're supposed to take your certification exam and get into your space for going to your new job. Where's your employer? He's out there struggling too, I guarantee it. You need to touch base with him or her. Make sure that you tell them that because of the COVID-19, the testing centers aren't open, so you're not able to test like you had planned. So you may have to postpone the hiring date. But talk to them, let them know where you stand. Make sure that they're still wanting you because they probably have closed their doors to patients as well and are waiting to come back. So make sure you keep those doors of communication open with not only your families, your best friend, your classmates, but also your future employer. The next thing we want to talk about is time management. Now, Dr. Baldridge already mentioned the importance of creating a calendar for your study sessions. But not only do you have to focus on your study, you have to focus on you and keeping yourself, you know, in a good space. Look at those tasks that you have on your calendar and then add something for you, maybe for you and your family. Remember, the time for family and friends is very important, but most of all, you have to stay healthy. Find time, even if it's just 30 minutes, to meditate, maybe pray, read a book, take a bubble bath, have that glass of wine. Whatever brings you to your good space, put it on the calendar, because if it's on the calendar, you know you're going to get it done. So look at those tasks, check them off one by one, and stay focused on that goal, getting to that certification exam and getting your future on track. The next thing you want to do is things that you can help reduce your stress. Take care of you, like I said, exercise maybe, do some fun things. But it's huge to get this stress off your plate. You have to stay physically, emotionally, spiritually, and mentally healthy. Because if you get run down, you cannot perform well. And the increased stress is felt by all of those around you. So you have to be at your best as often as possible. Keep telling yourself, I got this, I can do this. Stay focused on those end results. Hang tight. So when do you think you're ready for that certification exam? Only you can determine that. What is the right time? But don't rush it. Be prepared. If you have done your study plan, you're ready. Did you improve those knowledge deficits? Yes, you're ready. One way to get a good idea about where you are is to take one of APEA's predictor exams like Dr. Baldridge mentioned. This is going to tell you if you're ready. If you scored that 70% or greater, that predicts a high likelihood of success on the certification exam. You are ready. Schedule that exam. If you have your house and family in order, everyone is back on track, or things are getting as normal as possible, you're ready. You're focused, you're ready. You're emotionally and mentally healthy, you're ready. Go for it. You're in a good space and you should be successful. So one more thing is, remember, you are the class of 2020 graduates. You will be remembered as that special group of students that did what they had to do to get the job done during this pandemic, and you succeeded. Wow, what an accomplishment. Congratulations to all of you who'll be graduating this year. You are awesome and you deserve that diploma. Frame it and display it proudly. We are very proud of you, so hang in there. Okay, Dr. Amelie, back to you.
Betty, thank you. And I can't think of anybody better to talk about that than you, considering all the different challenges you've experienced, in your lifespan. So thank you for doing that. For everybody, we're going to take questions, but in the meantime, while some of them are coming in and I'm waiting for Michelle to come on, we want you to know how happy we are that you joined us today. And we have a little something for you. You know, when I was in college and I was a poor, hungry college student, I would get something from my mother, and it was called a care package. And it usually had a little food and it had some money in it as well. And we have a care package for you, just because right now things are tough and we feel like maybe you need a little something extra. So check your email tomorrow. If you register for the conference, or the webinar rather, you're going to get this from us. It's going to be savings, and it'll give you a little break during this very difficult time. There's also free shipping. So I'm going to open it up, and I hope that just kind of whet the appetite and help you feel comfortable with some questions. But what are you thinking about? Michelle, what are they asking about?
Well, hello. Thank you so much, Dr. Amelie, Dr. Kathy, and Betty, for that great advice to these students. And thank you, students, for joining us for this event. We're so happy to be here to help you during this time. We do have a few questions that have come in. The first one is from Candace, and her question is, can you talk about where to start from here? I have the course manual from the live course, so she's attended a live course. She has access to review questions, so I'm thinking that she means the QBank, the clinical guidelines book, and she's taken the predictor exam. In what order should I complete these?
Kathy, you want to start? So she probably is waiting to test.
Right, that's what
you think, Kathy, and then we'll kind of all go through.
So it says that you have taken the predictor exam, correct? Am I understanding that? That's the first place to start, is taking that predictor exam so that you know how to build your study plan.
Right.
Most of us, when we're studying, we tend to deviate to the areas where we're comfortable. So if you were a cardiac nurse or you worked in a neuro suite, you just kind of tend to deviate to those areas because it makes you feel good when you review that information and you're like, yeah, I know that, I know that, I know that.
I got it.
Yeah, I got it. But we tend to stay away from the areas that we're less comfortable with, and that's really the areas where we need to focus. So that's one of the things I love about the predictor exam, is because it breaks it down and it shows you exactly where you need to focus your concentration. So that's definitely the first step. Yeah. The second step, I'm glad that you've taken a review course and you have access to review questions that you received as part of the review course. And if you haven't taken a review course, for those that are listening, that's definitely a great avenue for you. And so go through those questions. Again, if you have cardiovascular for the day that's on your study plan, return to the book, the course manual that you got in the review course, review all that cardiology information, take those cardiology questions and see where you are. And like Dr. Amelie said, break down those rationales that are part of those questions, because there's really good meat there. And if you've come across something that you're like, gosh, I don't remember the pathophysiology behind heart failure as much as I should, then chase that rabbit. Go look at the pathophysiology for heart failure so that you can firm up that foundation of knowledge that you have there. So the questions are key. Reviewing the process for the knowledge area is key, and I think that's a good plan for you.
I would add just one thing. I think I agree with you on every aspect, Kathy. I would take the manual that you got from the review course that you took, wherever it was, and go through it and make sure that you know everything in there. That manual should be just the foundation of what you should know to be, able to take this exam. So make sure that you go through, and you need to know the stuff in there. Students always ask me, hey, Amelie, how well do I need to know this? You know how well you need to know this? You need to know it as well as your middle name. You need to know it as well as if I said, what's the last 4 of your social? What's your cell phone number? That information ought to just pop right out of you. And if it doesn't pop out that easily, then I don't think you know it well enough. Because what happens is that when you go into the exam, everybody is going to have a certain degree of anxiety. And when you're anxious, you don't remember things as well. So you need to have that information in you just rock solid, so that when you're anxious, you'll know that you know it. Give yourself about 10 minutes or so in that exam to kind of settle down, take some deep breaths, and just know you're going to find your groove. So you'll get there, but you got to know it rock solid. So I would start with the manual from the review course that you took. All right.
I have one other thing to say.
Yeah, Betty.
One other thing is, look where your certification exam, which one are you taking? Go to that site and look at the exam blueprint, because the exam blueprint is going to tell you what you need to focus on. It's also going to give you a couple of practice questions. So I think checking that exam blueprint is going to help you too, and that will make you a little bit more focused.
Yeah, great.
So this discussion segues perfectly into a question that I'm sure a lot of people have, and that is, how can I overcome test anxiety?
Okay. I'll answer that one, because I'm probably the most anxious person in the webinar, and I always want to make sure that I'm well prepared. And the reason I tell you that is because when you're anxious and you're well prepared, you know it's going to come out of you. Maybe not right this second, but it's coming. So here's what I would do. First thing is, I'd make sure I knew my information cold. I would know it well. The second thing is a trick I never did, but I recommend it to people and they love it. About a week before you are scheduled to test, I want you to go to the testing center. I want you to go look at the neighborhood. I want you to know if the front door squeaks. I want you to know the temperature. I want you to go in and see what the chair looks like. I want you to go in and see if the computer keys click. I want to know if the floor has carpet on it. Does it make noise when people walk? What does it smell like? I want your brain to take some visual images of that testing center, because you're going to be back in a week. And once your brain has those visual images and you get home, I want you to pretend that you're in there. And I would even practice questions and pretend that I'm in that testing center, so that when you go in there in about a week, it's a place that's familiar to you. It's not a brand new place. What is that noise? It's going to be a place that's familiar to you. So that's a good one. The third thing is, if you really, really have bad test anxiety, I would consider going to see my provider and getting a beta blocker. I really would. If you have bad test anxiety, the first time you take it better not be when you take your exam. All right. So put yourself through a practice run a few days before, take the beta blocker and see how you do with it. I've never had a patient who did poorly with the beta blocker, but those are my 3 best clues. I don't know, Kathy, Betty, what do y'all think? Any other clues for
I
her?
agree with you, Amelie. I would just make sure I get a good night's sleep, and I would eat the morning of.
Yes.
Make sure you have something in your stomach so you don't get a low sugar and get all, confused. So
Right.
eat and sleep well.
Yeah, that's
And
good.
everybody makes the mistake of like cramming hard that day before. Take the day off and go do something fun. That last day of cramming for 12 hours is not going to help you retain information, and it's probably going to stress you out so bad that you won't be able to recall information the next morning. So do not cram that last day before your exam.
Yeah, that's great advice. I forgot, I usually tell people, make sure you're well hydrated, well fed, and well rested. So that's very sage advice.
Now we have a question about answering exam questions.
Okay.
Anne says, I have read that there are always 2 answers that can be ruled out as being absolute. Can you speak as to those answers and how to look for them, please?
Yeah, I agree with you. I think if you get an ABCD question, 2 of them can be immediately ruled out. Then that leaves you with 2. And people usually tell me, Amelie, I can get it down to 2, but my trouble is, how do I know which one is right? And usually that tells me, if that happens consistently, it tells me that you haven't broadened your knowledge base quite enough. Because one fact that your brain has in it will tell you it's not number 3, it's number 4. So usually when you reach that point where you have it down to 2 and consistently I get it to 2 and then I can't, that tells me you need to stretch your knowledge base some more. And the best way to do that is by working through multiple choice questions and really inhaling the rationale. So that's my best advice.
Yeah, and I
Great.
saw that someone had kind of asked about, that maybe they answer questions on paper. And so how do you transition? Look, your exam is not going to be on paper. It's going to be online. So I do encourage you to answer questions online because you need to practice getting in the habit of answering those questions. You don't want the first time that you see a question to be on the certification exam on the online format.
Right.
So practice answering questions. Read the STEM, formulate your response. Most of us do that anyway. Look and see if your response is in the answer choices. If it is, choose it. Go back and read the rationale. The STEM, make sure you got it and move on. If it's not there, if it's not in the answer choices, you can usually narrow it down to 2. You go back, you read that STEM again, and you pick out those key characteristics like Dr. Amelie went through.
Yeah,
what is their
relevant
age?
terms.
Yeah. And then you go back and you answer that question and you move on. So you need to practice that process of answering questions on an online format.
Yeah.
And one more thing is when you're doing your practice exams at home, time yourself because your exam is timed at 3 hours, which allows about 1 minute and 12 seconds, 15 seconds per question. If you're taking longer than that, that's too long. And if you answer them too quickly and you're getting it wrong, you're missing something, slow it down. Watch those keywords that'll steer you in the wrong direction. So watch your time.
Thank you all for that. We do have a few questions from people who are wondering if you have any thoughts or maybe preview of what is going on with testing centers reopening or the possibility of doing online testing for the certification exams.
Okay, I have some thoughts. First of all, don't expect them to say, oh, listen, let's let you take that certification exam from your home. Not in my lifetime, that's not going to happen. I do not see that happening. I really don't see that happening. The second thing is, this is just, I have no inside information from either PSI or Prometric. I have no inside information. However, I imagine that when our country begins to open up, meaning people can move from one place to another freely, that the testing centers are not going to open up at full capacity. I just don't see it. If a testing center could accommodate 200 people, I would imagine when they first open up that maybe they're going to allow 40 people in there, or maybe 50 people, so that the place is not packed. There's something else I want you to think about, and it is this. You aren't the only professional who's been deprived of taking a certification exam right now. Everybody else has also. So are people who would take the GRE and any of those standardized exams. So everybody is going to be fighting for a place in those testing centers. And I think that you might be ready to take the exam, but that you may not be able to get a seat in there when you think you want to take it, because there's going to be so many people who want to take those exams. And that's just my thoughts. Kathy, Betty, I don't know what y'all think, but
I agree with you.
yeah.
And Betty, you want to tell them how to check AANP and ANCC?
Right. You can go to their website, and there's a link to PSI, which gives you every location in the country. And it tells you how to contact them and if it's open or closed. And of course, you know, like me down here in New Orleans, we're probably going to take a little bit longer to have our testing centers open, or New York, whereas maybe some place that doesn't have as many cases of the COVID-19, you may open up sooner. So just keep an eye on that. I think when I looked last, they said the 15th of April, but they had pushed it back to the 30th. So just check it routinely every day, maybe every couple of days, every week, but they do update it frequently. So go online and look for the PSI testing locations nearest you.
Okay, great. Thank you so much. I have first, before I ask the next question, I wanted to share a tip from Terry, who wants to let everybody know that the Headspace app has a meditation specifically for test anxiety.
Oh, good.
Yeah, so
Thank you, Terry.
In our audience, we also have some nurse practitioners who may have gotten certified or finished their program, didn't get certified for one reason or another. So they're trying to get into the workforce again in the NP role. So Catherine explains that she has been out of the workforce for 25 years after practicing for 2 years as an NP. Then she stopped to raise her family. She has reactivated her RN license, done contact hours to receive her NP license. She was not required to take the certification exam because she was grandfathered in, but she's not comfortable in the current role of the NP, best illustrated with farm and writing scripts. How does she fill this gap?
Honestly, if you've been out for 25 years, the first thing I would do would be to take a review course, because it's really going to walk you through all the latest guidelines. It's going to tell you and teach you how to take those certification questions, which you've been out of the habit of. So the very first thing I would do would be to get in a review course to see where I am, and that would help me assess how much time I would have to put in. But we would welcome you back into the workforce.
We also have, I'm sorry, Betty, go ahead.
I'm sorry. She said she was weak in form. You know, we have some products that she can look for form. Maybe there's a lot of information out there that you can get a form update course too, not just a review course, but if you're really weak in form, try a form update course, and then, you know, check some of the questions that study questions that focus strictly on pharmacology.
You know what? I don't want to sound like I'm selling a bank of questions that deal with prescribing and pharmacology, but we have some really good ones. And if you haven't been in the realm of like practicing questions, that Form Q Bank or prescribing would be really good, because it would give you practice with answering multiple choice questions, which you have to get back in step of doing. And you're going to learn an immense amount by looking at the rationale for all of those prescribing questions. So I think your pharmacology knowledge would swell immensely, and it's specific for practice and your exam. So that would be a good thing to do as well.
Another theme that I'm seeing in the questions is encapsulated with this question from May. It says, so what do we do if we are ready now but can't test for several months?
Okay.
How are they going to keep it in their brains?
Kathy, you have a thought? Betty?
Go ahead, Kathy.
Remind me, tell me again what she's asking specifically. She's
So there's
graduated and cannot test.
Right. So there's a few
Right.
people who have done their study prep, they've done their study plan, done a review course, and now they're like,
Yeah, you got to stay immersed in that information. You really do, because you don't want to lose the momentum of the information that you've gained. That's why we tell people, if you have an option, you really shouldn't wait 6 months to test after you graduate, because you're going to lose some of that student momentum. So I think it's really important that you stay in a student mentality mindset. And so answering questions and staying within the information, immersed in the information. So I would continue to have a plan, and I would continue to focus on areas so that when it does open back up, that you're still prepared.
Yeah. You know what I would do? Depending on how much time you have, when you get back from work, or how mentally exhausted you might be. But if you're ready, you just need to test to make sure that you stay in step. I would pull 10, maybe 20 questions, depending on how mentally exhausted you are and how much time you have. I would change one fact and I would go through them. And some of them, I wouldn't be able to answer my own question. I'd have to go and look it up. But if you do that 10 or 20 times a day, it's going to be like riding a bicycle. You're going to still be in step. And about a week or 10 days before you get the testing date, like they give you a date, March 23rd, about a week or 10 days before then, I would kind of get back into taking some practice tests, so I could get back in the momentum. You'll be in good shape. Don't worry.
You will.
That is great advice. We have a question from Caitlin. And she asks, how do you recommend retaining and studying information such as pediatric milestones, the Tanner stages, and immunization? I struggle with these concepts. I know you say not to memorize and to understand instead, but I'm having difficulty with these as well as heart murmurs. I feel the need to memorize this information.
I'll take that one.
Please, Betty.
That's a good question. And I, like Amelie, don't want to make this about selling our products, but if you go to our website, we have an excellent flip chart on the pediatric developmental tasks. It also includes the reflexes, the cranial nerves, and the Tanner stages. So the only way you're going to become competent in your knowledge of it is to review it often, and do it by groups, like maybe the infant, the toddler, the school-aged, the adolescent, as opposed to every age group there is. Now, for sure, the babies under a year, those developmental tasks develop so quickly, so you kind of have to focus a little bit on some of those more often than I would other than the toddler, So learn it in their age group rather than every single month. And as far as the Tanner stages, you just kind of have to know what they are and how to pick them out. I can't really answer that other than sometimes you're just going to have to remember it. And the more you see patients with it, the better you're going to become. And there's also flashcards too that can help you, but you just have to kind of review it, I guess, from time to time. There was another question you had, Michelle.
That was included. They were also asking about heart murmurs and said they had a little trouble with that as well.
That's practice. There are some, if you Google heart murmurs, you can get some sounds that you can listen to it over and over again. That's what I would do. And it's going to be very hard to say, I can listen to all of these in clinical, because you may not have that many patients with heart murmurs. So I would look for a program that talks about heart murmurs and allows you to listen to the sounds. And there are a couple, if you go to, I hate to say YouTube, but YouTube does have some really good sounds. And there's a few areas, if you type in heart murmur sounds, there's a couple of programs out there that would help you listen for them.
Yeah.
Thank you very much, Betty. We do have a question. This has popped up in a few different ways. How many questions or hours of studying would you recommend per day or week?
That depends on you. It depends on your situation. How many hours are you having to work? And, you know, it's not just how many hours you're working, it's how exhausted you are when you come home. I would like to see you do a little something, you know, I can't even say every day. You know, one of the most important things to know or remember is that you have to go into this exam with a refreshed brain. And it's probably not going to be right after all of this stress is over. Be patient with yourself. Betty talked about that. But you got to have a fresh brain. And so it just depends on how many hours you're working. And, you know, sometimes you get home and you got a house full of kids and they all have homework and they all got stuff going on and you know, you're homeschooling them. So, you know, it just is going to depend, but everybody's a little bit different. You have to learn it and remember it until it just pops right out of you. However long that is, you know, does it take you 3 times to review it or do you have to review it 6 times? It's going to be very, very variable.
And that's why it's so important, I feel like, to actually make a plan. When you see your plan in black and white and you review your agenda for the day and you say, okay, I'm working 12 hours today, and when I get home, I'm going to help kids with schoolwork, and then I'm going to take a bubble bath. So you know there's no studying on your plan for today.
That's right.
Right. But then Wednesday comes and you're like, okay, I have 4 hours for cardiovascular. And then the communication comes in. So you tell the family, you tell the friends, you tell whoever, hey, look, you guys, I'm studying cardiovascular today. I won't be available till afternoon. It all rolls in together. And so you use the time that you have most efficiently, because you don't want to be stressed out when you go take the exam so that you can recall information. If you're stressed out trying to study, you're not going to retain information either. Right. So it's just so important to see that plan in black and white, know what you have coming in front of you for the week, and be able to communicate that to everyone. And you're going to get the most out of the time that you do have slotted, whether it's 2 hours, 4 hours, or 30 minutes, then you're going to get the most out of that time.
Yeah.
You've got to find your safe space to study too, you know, and let the family know, if I'm in here, I'm not going to answer any of your questions. So take care of yourself for a little bit. Put the sign on the door, do not disturb mom, you know, so that you have your safe spot and you can go there and study and concentrate and stay focused.
Thank y'all so much for that. We do have some questions about the best way to use the predictor exam and the timing of the predictor exam. So what do you recommend?
Kathy, go ahead.
Okay. So depending on where you are, if you're just waiting to test, or if you're waiting to graduate, we usually recommend that you take it, you know, at least in the last semester, but specifically about 4 weeks prior to your ready to test date, so that you can have time to work your plan to remediate whatever your weak areas are. You know, if you take it the week before your certification exam and you've got a lot of weak areas, you're not going to have time to remediate those. You're not going to have time to spend enough time to study on those. So about 4 weeks is usually a good time frame. It does kind of depend on everyone's life, but that's typically the recommendation there.
Yeah, I'll even recommend you take it, you know, as early as 2 weeks before. But don't take it, you know, like the night before. That's way too late.
No, and you can take it more than once if you choose to. Usually twice is about all that you really need. So you can take it once, study your weak areas, review all of those, and then take it again to see where you are.
Right, and so you'll always get a different one, because a predictor exam is predictive. So you take one, you won't see those questions again. You can take another one, it's completely different questions. So if you've seen a question before and you get it again, it's not predictive. And so anyway, you can take several of them on our website, but like Kathy said, take one, make your plan, go study your weak areas, and consider taking it again just to make sure you're above 70%.
That's right.
Thank y'all. I have a question from Terry, and she's been in nursing for quite a while, and we certainly meet a lot of nurse practitioner students at our review courses who have been nurses for a while, and now they're transitioning to the role. So her question is, one thing that I do is rely on, I'm sorry, I need to reword this. her clinical experience leads her down the wrong path. What's the best way to approach questions without relying on my clinical experience?
Oh, okay. I know exactly what we have a lot of people who've been in nursing a long time, like Terry says she is. And so I usually tell people, you have to take off your I've been in practice for a long time hat and put on your I'm a brand new NP hat, because you're taking an NP exam and you're taking a primary care exam. So especially if you worked in a specialty area like the ER, orthopedics, take off that hat and you got to begin to think like a new NP. And that's where I think a review course really helps you, because it makes you look at entry-level information. That's what the exam is going to ask you about. And while you may be familiar with the information, this is a totally new roles for you. So, that's my best advice, is to really begin to think like a new NP. And you do that once you begin to get engrossed in the clinical guidelines, because you think differently as an NP than as an RN. So, that's my best piece of advice.
Right. And most nurse practitioner students, I find, when they're answering questions, they are answering questions based on what happens in the hospital, where you have all these resources at your fingertips. And there may be multiple variables that are telling you to get a CT scan or to do this particular test. And so I always tell you, imagine yourself as the sole provider in a rural health clinic, and you don't have all these resources at your fingertips. And that's really where your evidence-based guidelines are going to take you. So when you remove yourself from the hospital setting and put yourself mentally in a clinic setting, I think it's going to help you be able to differentiate that.
Yeah.
Thank you so much for that. We do have also Brandy asking about creating that study plan. You gave such great advice about making the calendar and everything. So Brandy asked, do you recommend waiting to schedule your exam until you are confident, or scheduling according to a deadline that you've set for yourself? Does that make sense? Do you recommend waiting to schedule until you are confident, or to schedule for a particular deadline?
Dr. Amelie, you want me to take it?
Oh, yes. I tell people all the time, the worst plan you could have would be to say, I want to get this done before May 31st because my birthday's the next, I want this done. You only want to take this exam once, which means you need to take it when you are ready. So whatever you do, don't set a certain date, because that's going to force you into doing something maybe before you're ready. And I don't want you to take this exam before you're ready, because I only want you to do it once, and you only want to do it once. That's why something like a predictor exam is valuable, because it lets you know, do I know enough? That's the magic question that everybody wants to know. Do I know enough to pass? Can I go right now and do it? That's why we developed the predictor exam, so that people would have some way of knowing.
And it removes your anxiety from the equation, because I have seen students, they schedule their exam, they study, it gets a week out, and they're like, oh no. And so they push it a week, and they push it a week, and they push it a week. Well, that causes you even more anxiety. So at least having the predictor exam gives you a very valid number. And so you kind of get yourself out of your head a little bit too.
Yeah.
Thank you so much for that. We also have several questions from people who would like to know your thoughts on choosing between the ANCC and AANP exam. Like, what factors should they consider, and how different would the preparation be?
I'll take a crack at it. So here's what I always recommend people do. If you're trying to decide whether it's AANP or ANCC, make sure you go to their certifying body's website. Go and look at the exam blueprint. Now, it's not going to be as enlightening as you wish it would be, because you wish it would say 12 questions on cardiovascular, 7 on derm. It's not going to do that, but it's going to give you a good idea of what the topics are, So make sure you go and review the exam blueprint. They're pretty darn close, because you probably know that ANCC changed its exam blueprint in 2019. So it's way more clinical than it used to be. But to be honest with you, the APEA predictor exam predicts passing of 70% on both exams. So, it's a good measure for either one. But it's ANCC's exam is a little bit longer. It's 3.5 hours. So if you find that you're somebody who has difficulty with focusing, then, maybe a shorter exam is better for you. But, both allow you to practice in all 50 states. They both give you the same privileges. You get paid by Medicare, Medicaid. I don't see an advantage to being certified by one over the other. But go look at the exam blueprint.
Thank you so much. Joanna or Jonna asks, will there be many questions on the exam, such as the respiratory question that they just walked through with you, Dr. Ollier, in the beginning?
That is 100% fair game on your exam, what I went through, because that's management of a basic common illness. In the realm of pulmonary, we think of acute bronchitis, we think of pneumonia, COPD, and asthma. You have to have your arms around those common diseases. So what I tossed out was pneumonia, and yes, that's absolutely 100% fair game on the exam. So yes.
And Jonna, also the second part of Jonna's question is, in the case that new evidence-based information that they're familiar with in practice may not be the right answer. In other words, was the test written before a guideline change, and how should they be thinking about that?
Yes, because exam questions take at least a year to write. By the time you establish reliability and validity, they're at least a year old. Consequently, what you have to do is you go and look at the blueprint, go and look at the reference list that they use to write the questions. And your eyes are going to pop out of your head when you realize the exam, the references, the dates on the references are 2017, 2018. That's why taking a review course in the same year as your test is a good idea, because in 2020 in our review course, it takes into account 2017, 2018 guidelines, because you don't want the latest, greatest information. If you take an old review course, something from 2018, it's going to be relying on way older information. So you got to take something that's prepared for students who are going to test 2019, 2020. You got to be, real close with that. So.
Thank you very much for that. Karima has a scenario that I bet a lot of our attendees do.
Okay.
She's a student whose clinical experience was cut short due to the pandemic.
Yeah.
She will still be able to graduate. So do you suggest seeking a shadow experience or a fellowship experience for more clinical exposure?
I'll take it unless somebody else wants to jump in.
You can take it.
I've never met an NP student who got out of school and said, I have enough clinical information and knowledge to go into my first job and I'm going to be the star. Everybody always feels like they need more clinical exposure. Everybody just does. And the way I usually tell people to handle that is to start out slowly when you start in your clinical practice, whatever job it is. And whatever patients you saw that day, maybe the first day it's 5 patients, 8, 10 patients, go back home in the evening and go read everything you can about them. And, that's why I like our clinical guidelines book, because you can go and in 2 or 3 minutes with all the bullet points, you can pick up the most salient aspects about the patient you saw who had hypothyroidism. If you do that, if you had done that as a student, in fact, if you're a student listening right now, when you see a patient in your clinicals as a student, you should go home that night and get a clinical guidelines book and just spend 5 minutes looking at the diagnosis of the patient you saw and do it every time. So in a year and a half worth of clinicals, you've looked at hypothyroidism 20 times. Well, it's just, you're going to sail through your exam if you do that. It's usually too late for people to know that. So I tell them, when you get in your practice and you see 7 or 8 patients that day, go home and go learn all you can about those diagnoses, because you see them over and over again. And then you're going to be great. Just be patient with yourself. There's a reason they call this a practice. It's because you practice all the time, and you get better the more you practice.
Wonderful. Here's a question from Isosa, who wonder, what is the best method to memorize the different classes of antibiotics?
When Betty was talking about like the milestones, and I was kind of chuckling to myself, because What I would do for antibiotics is exactly what I did for my Tanner stages and my milestones, because I did not know my milestones. I wrote them on cards, and my commute to work was about 18 to 20 minutes every morning. And when I stopped at a red light, I'd pull out a card. And I went over it, and I went over it, and I went over it until I got it. So with antibiotics, 1 week I'd pick penicillins. The next week I'd pick cephalosporins. The third week I'd pick macrolides. And then when I finished the 5 or 6 major classes, I mixed up my cards and I would force myself to answer them. Listen, you would never have made it this far in your professional career if you weren't smart, and you are. Consequently, what you have to make sure that you do is you just repeat it enough. Some people need 2 times, other people need 5. Just spend the time and you're going to get it. You really will get it. So, you know, repetition. You could teach a stump antibiotics. It's all about repetition.
I am keeping my eye on the clock, and we have a lot of questions that unfortunately we won't be able to get to, but one that I think would really benefit some of our attendees who particularly have written in is about, in that instance where you are not successful in that first attempt, what advice would you give them to get ready for that next attempt?
So I do help students develop a study plan after they have not been successful on their first attempt. And honestly, the study plan looks pretty similar. If you haven't taken a review course, you got to get into a review course, because you need to really hear that information and connect the dots again. If you haven't taken a predictor exam, take a predictor exam. And most students that I see that have not been successful on the first attempt did not work a study plan like that. That's how I know that the study plan that we gave you is tried and true, because I hear from those students later and they respond and they say, gosh, I wished I'd have knew about that beforehand, because it really did help me to focus on the areas that I needed to learn more and firm up that foundation of knowledge in. So it's just a tried and true method of being able to learn those areas where you're the weakest, to firm those areas up. When you get your report from that certification exam, it's going to tell you you were either weak in assessment, diagnosis, planning and implementation, or evaluation. So taking the predictor exam and finding out the knowledge areas and then focusing on all those things through answering question after question after question and focusing on those weak areas. Through the Clinical Practice Guidelines book, it's just a tried and true method.
And, you know, one quick piece of advice is, if you find out that you're not successful, you need to take a step back and see what you did that needs doing differently. And, you know, with
Right.
APEA's review course, we're so confident 99% of people pass on the first attempt. If you're not successful, you need to let us know.
That's right.
My name is on that course. You know, I'm invested in your success, and I take a lot of pride in that course. And we want to make darn sure you're successful. I mean, that's what Kathy does. Kathy helps people who haven't been successful, and it's not just our course. They've taken somebody else's. And that's how invested we are. We want to make sure you're successful. That's why we're here today. So,
Right.
you know, I'm looking at the time, and I think we can probably take a couple more questions, Michelle. I see a lot of questions in the Q&A box. And if people feel like this was helpful, I would like you to put a chat in and say, yeah, we'd like to, you know, we'd like to continue this. We'll come on again with another hour next week at some point. So if you found this helpful, please let us know in the chat. We want to be able to get to your questions, but, you know, time is always an issue. Let's get a couple more questions, Michelle, and then, you know, we'll go from there.
Okay. We've got some questions about life kind of beyond certification as well.
There is life beyond certification, Michelle.
Marissa asks, after passing the exam, what is the best resource to keep updated for new evidence-based guidelines? The question you presented about pneumonia states the new guideline is for high-dose amoxicillin, where is one source to learn all the updates?
That's why I'm such a nerd. I read all the time. You know, the best way to keep up, to be quite honest with you, is either to go to a conference, because you'll hear, what's new. Come to a review course and clinical update that I teach. APEA teaches them all over the country. We always give you the latest evidence-based guidelines, and we kind of tamper that with, this is what they ask you on the exam. This is what you need to know for practice. So doing something like that will help you keep up. I read a lot of Medscape. I love Prescriber's Letter. It's not free, but it's a good one. I read all the time. I like AANP Smart Brief.
Right.
We have there are a number of them that, Betty and Kathy, what do y'all do to keep up?
The same thing that you just said, because when there's a change and an update, if it's the Infectious Disease Society update, you're going to get it on one of those because they're telling you all the updates. There's no one particular update website. So yeah, AANP is a good one. Medscape is a good one. Hippocrates has updates on it as well. So when there's new material that's coming out and you just read it, hit the highlight.
Yeah, and make sure you're using those that are particular to your discipline. Like I do most of the pediatric ones, AAP I also do NAPNAP, just subscribe to a lot and you'll get it in your inbox. So just whatever your discipline is what you need to kind of focus on too.
Yeah, and don't forget about CDC. There's a number of updates, and FDA for drug updates. So my box gets all that stuff all the time. You can look at it quickly, hit delete if it's not pertinent. How about one more?
Immunizations too.
Yeah, exactly. I get CDC all the updated immunization information.
Before we ask this last question, I do want to express how excited I am by how this went today, and that our great NPs are going to be ready to host another town hall for you students very, very soon. So be on the lookout in your emails for a future announcement, as well as tomorrow, our student care package, all the details on some special sales that we're going to offer to you. So there are many great questions in here, and I feel bad that I just have to pick one to finish with, but it's come up a few times, so I think that I'd like to share it with you. And it's basically from someone, multiple people who asked, can you talk a little bit about the difference between the questions in the question bank and the predictor exam? Like, how should they be used, and what are the differences?
Well, we kind of like the Q bank for your studying. Right. Q bank is a study. It's interactive. You can be very repetitious. You can see questions that you've missed, questions that you have never seen before. You can take as many exams as you want. The questions are written similar. It depends on which Q bank you use, but if you're using the management, it's written similar to those questions you're going to see on the predictor exam as well as on the certification exam. Yeah. And then we like you to use your predictor exam as a way to telling you if you are ready to take that certification exam. Amelie, Kathy?
Yeah, I was going to say there are two kinds of questions. Questions that teach you things. That's why the rationales are so important, and that's what QBank is about. And then there are questions that measure things. That's what your certification exam is, and that's what our predictor exam is. So use the questions to teach you things, inhale the rationales, and then use a predictor exam because it measures something just like your certification exam.
Right. And when you take that predictor exam, I want you to treat it just like a mock certification exam. Exactly. Again, put it on your calendar, 3 hours, because that's how much you're going to have if you take AANP, 3.5 if you're going to take ANCC. Mm-hmm. Allow yourself that time. Take your phone out of the room. Don't look up answers to questions because you really want it to measure your knowledge. So treat it just like a mock certification exam.
Good point.
Wow.
Great point.
I can't believe that the time has elapsed already. Michelle, thank you so much. I think you did a great job as our moderator. To everybody who came and attended, we loved having you. I wish that we could have met you in person. But thank you again to our panelists, Betty, and also Kathy. Thank you, everybody behind the scenes who helped put this together. And look for something from us tomorrow in your email. Good luck, everybody. Best of luck on the exam.
Bye. Good luck.